So the dental team, the whole of the dental team, which is the dentist, the oral health therapist and the prosthetist, collectively are really important to looking for oral cancer and also discussing with the patient oral cancer risk. Can you tell us, do you smoke at all?
No, I don't smoke.
No. What about alcohol consumption? We should be talking to the patient about their habits that increase the likelihood of getting oral cancer, in particularly smoking and all tobacco use, but equally other things that we know that are associated with oral cancer are excessive alcohol consumption, as well as more recently in Australia, betel quid use. So the most common presentation is a persistent ulcer or a lump in the mouth that has been present, that the patient's been aware of for more than 3 weeks. The most high-risk sites are the lateral margins of the tongue and the floor of the mouth, but oral cancer can occur anywhere in the oral cavity. Other areas that we'd be concerned about, or lesions that we'd be concerned about, are persistent red patches, erythematous, or speckled lesions as well. To undertake a mucosal examination, there isn't any one particular way of doing that. It has to be systematic, and once you've undertaken it systematically, to continue to do that to make sure that you cover all of the areas of the oral cavity. One way that I like to do it is to start off with buccal mucosa, labial mucosa, and the attached buccal and labial gingiva, starting with the right buccal mucosa, making sure it's really well illuminated, that you can see all the attached gingiva, and then moving on to the left buccal mucosa. They're examining that in the same way. And then getting the patient to close their mouth so you can examine the labial mucosa, their lip, and the attached gingiva in both maxilla and mandible. So then getting the patient to open wide, we'd be able to examine the floor of the mouth, which is a high-risk site. So we make sure that we can examine the whole of the floor of the mouth, as well as the attached gingiva on the mandible, ventral surface of the tongue, and then easily using reflected light to look at the palate, the hard palate and the soft palate and the palatal gingiva. You can then move on to the dorsal surface of the tongue and looking at what we can visibly see in the oropharynx. Sometimes that's easier to get the patient to say ah, so that we can look at the visible portion of the oropharynx. One of the most important areas to look at, to examine carefully, is the lateral margins of the tongue, and that's usually best with a piece of gauze. So taking some gauze and carefully examining both the left and right lateral margin of the tongue, and at the same time we should be able to examine the most posterior part of the ventral surface of the tongue as well. So we then need to move on to the neck extraorally and looking at the submental regions and the sternocleidomastoid, the jugular chain of lymph nodes there. It's also a good opportunity to talk with the patient, to ask them about any symptoms that they've had in the neck, whether they've had any lumps, they've noticed any lumps, or any change in their voice, any hoarseness or difficulty in swallowing as well. So at the end of the examination, we should be doing 2 things. Firstly, recording our findings in the clinical notes, and that may include photography of any lesions that we're concerned about as well. And finally, I think a very important aspect that the dental team should be doing is discussing risk factors with the patient, particularly smoking cessation, decreasing alcohol consumption, decreasing betel nut use if they are using betel nut, but also talking about the presence of HPV, the human papillomavirus, as that can be linked particularly to oropharyngeal cancer. So there's 5 key components to the oral examination, to recap. The first is to undertake a thorough examination of the buccal and labial mucosa. The second, to look at the floor of the mouth, lateral margins of the tongue, palate, as well as the oropharynx. And thirdly, to do an extraoral examination, looking at the patient's lymph nodes in the upper cervical area. Fourthly, to record all your findings, which may include photography. And finally, to discuss risk factors with the patient about their development of oral cancer.